Welcome to Collab Conversations with the American Diabetes Association and Beyond Type 1. My name is Ginger Vieira, and with us today is Dr. Nuha El Saeed, who is the Vice President of Healthcare Improvement at the ADA.
Thank you for having me.
So today I would love to pick your brain about insulin resistance because it affects now how many tens of millions of people in our country and then even more across the globe?
It is, it is the root cause for type 2 diabetes, and it's not just people with diabetes, it's people who have prediabetes, people who are overweight, obese. So it is a lot of people, Ginger.
Okay, yes. Okay. Right. So
I would say, I think, you're talking about more than 80 million people.
Wow. Yeah. Okay.
Yeah.
Can you define it for us? Can you describe what is insulin resistance in layman's terms?
So to understand insulin resistance, you really have to understand what insulin does. So insulin is a hormone, and it has, you can think about it as a key. It gets glucose from outside of the cells to inside of our cells, and our cells are our building blocks. And it's a very important hormone because if glucose does not go in, then we do not have energy and we cannot survive. We have three main organs where this occurs, and it's very important that it happens. So you have your muscles, your fat cells, and the liver. Okay. And for people who have insulin resistance, as the name implies, there is resistance to entry of glucose into the cell. So these keys do not work. Those insulins do not work. So what happens is your pancreas has to work over time. So the pancreas has to make many more keys to break in this resistance at every cell door. And that in itself is a problem.
Right.
In medical school, they teach you that insulin is a growth hormone. So that does not help, if you're overweight and it just becomes a vicious cycle.
Right.
And the good news is we have so many medications now that help with insulin resistance. And there are many things you can do to help with insulin resistance. People with diabetes who need insulin just need insulin, and that's how it is. But when I hand somebody a prescription for insulin, I also speak to them about how can we improve insulin resistance so that the requirement is exactly what they need. They're not needing more than what they need, and they're not taking less than what they need.
Okay, so what can someone do if they've already at a point where they're at a high level of insulin resistance? What can someone do to help reduce their insulin resistance?
So, the biggest thing is really weight. If you think about it, it's weight. So, we encourage people to be mindful of what they eat and, the composition, the diet, we call it dietary pattern. So it's really the choices that you make overall. It's not a particular diet, it's just choices that you make. Exercise, and for exercise, we want them to do both aerobic and strength. Because if you think about this insulin resistance issue, it's at the muscle level. So you do strength, and that really helps. Overall, there are, again, a lot of medications. So working with your healthcare team to pick medications that would target insulin resistance, and we're seeing amazing results with newer agents, really.
Right.
And it's all about balance. I mean, there are people who have to be on insulin, and there is a way to take it safely. And we don't want people to be skipping, taking insulin, and at the same time, we don't want people to be over-medicated. So right. There's always a balance, and there's always an appropriate amount for each individual.
And even if someone is frustrated with the fact that their body is really struggling with insulin resistance, the first most important thing is to get your blood sugars down into a safe and healthy range.
Absolutely. There is a time when, when some people are newly diagnosed, or if they're going through a hard patch, when the numbers are really high, sometimes the only way to get it down is insulin.
Right.
And then after a few weeks, you have a discussion with your healthcare team, are other options, a viable option. And over the years, they have been, newer agents are now, in some places replacing insulin. In others, insulin still stands. Right. So, it's a dynamic process, really.
Well, thank you so much for that deep dive into insulin resistance.
Anytime.